Communal living and bouncing from place to place are just two of the challenges people experiencing homelessness face.
But during a pandemic, those two things put the homeless community at an extremely high risk of contracting COVID-19. As of this month, people who are homeless in Michigan are now eligible to receive the vaccine.
But as 7 investigator Ross Jones shows us, Detroit was prioritizing this population well before now.
It is very important in a communal living situation to keep the virus out.
Amy Good runs Alternatives for Girls, a Detroit nonprofit that provides housing and support for homeless and high-risk girls and young women. For nearly 10 months through the pandemic, the nonprofit managed to stay open and do what seemed impossible.
We kept the virus out of our shelter almost miraculously until December.
That's when the outbreak took hold, and 15 caught the virus.
Some staff and some of our shelter residents and even a toddler tested positive.
What happened here highlights how those experiencing homelessness have been some of the most vulnerable during the pandemic.
They're bouncing around from household to household. They have to use public transportation when they get from place to place. They often don't have access to health care, don't have access to a stable, safe home, let alone PPE.
And why it's not just those who are homeless that are at risk.
One cannot run a homeless shelter remotely.
This month, the state made homeless populations eligible for the vaccine, and Detroit specifically has been leading the charge.
And so we vaccinated over 2,300 people who are experiencing homelessness and also staff of about 30 homeless shelter programs in the city.
And to do it, they've gone directly to shelters.
They came to Alternatives for Girls twice. Once in January and once in February, 4 weeks apart, brought the Moderna vaccine.
At Alternatives for Girls, 33 residents were vaccinated, 29 staff members, and 18 volunteers.
We are focusing on meeting people where they are.
But despite making homeless populations a priority, battles still remain. One in particular is vaccine hesitancy.
People are really concerned about taking this vaccine, which is incredibly new.
The city recently conducted a survey to find out what was causing some to have second thoughts.
Two things that we noticed were people were scared about the side effects and people didn't want to take the vaccine and die.
We had some girls who were adamant that people die from the vaccine. And we tried to track that down, and it's just, it was what they took away from what they have heard on the media and from others.
The city tonight continues to prioritize vaccines for the homeless, and they say they're working on an education campaign to try to bring down vaccine hesitancy. We're in Southfield tonight. I'm Ross Jones, 7 Action News.
Ross, thank you very much.